Welcome, come in.
So we just have some questions for you. Are you ready to get stuck in?
Sure, let's go.
Well, firstly, what is your name?
My name is Ralston D'Souza.
And where are you from?
So I was born in India and I moved to New Zealand in 1998. And I grew up in Auckland, been around the North Island, now I'm in Taupō.
Great. And what is your profession?
So I am a rural hospital medicine specialist and a GP as well.
What does rural hospital medicine specialist mean?
So rural hospital medicine is a relatively new specialty in New Zealand. It only got formed in 2008 by the Medical Council, by a group of sort of rural doctors, realizing that rural hospital medicine and general practice were two different specialties. And so basically you are a generalist doctor who works in one of the 24 rural hospitals in New Zealand.
And how long have you worked in Taupō?
So I'm coming up to working in Taupō as a specialist for the last 2 years. I was a registrar here as well in 2020 and I spent about 6 months over here.
And how long have you been practicing altogether?
I graduated med school in 2016. Obviously went to med school in 2011. Yeah, what am I up to now? Probably 9 years post-grad.
And where did you go to medical school?
I went to the University of Auckland.
And where did you do your training out of medical school?
So during medical school, obviously I was in Waikato Hospital, I was in Middlemore, and then I was in Waitemata DHP between Waitakere Hospital and North Shore Hospital. After I graduated, I was in Whakatane for 2 years. And then literally I've been spending 6 months in different places till I finished my specialty. So I went from Whakatane to Tauranga to North Shore Hospital, North Shore Hospital to Thames Hospital, Thames to Taupō Hospital, Taupō Hospital back to Whangamata Medical Centre, then down to Rotorua, another GP practice, and then down all the way to Wellington in Lower Hutt, where I worked in the ED there at Hutt Hospital. And then a bit of general practice time there, one of the general practices over there. And back up to Taupō and did a bit of anaesthetics time in Rotorua. And then now I've settled down over here.
You've been so many places with your work and training. Why did you choose to stay in Taupō?
So I think as a reg here in Taupō, one of the things that really got me was seeing a fully staffed rural hospital. Seeing rural hospital medicine specialists all working together, running the emergency department, running the inpatient unit and the outpatient. So it was really cool to see a fully functioning rural hospital like it was sort of told to us during our training. That was probably one aspect of things in terms of the people. But I think what really drew me back was the Waiata sessions on Thursday. It was probably one of the only places I've seen around the country that's had that. The best way I describe it is sort of like the soul of the hospital. It's really a time for us to rejuvenate ourselves, both staff and patients alike, for whatever we're going through. So I think that's probably what got me back in the end.
Yeah, that is a really special part of Taupō Hospital. What made you fall in love with rural medicine?
I probably fell in love with rural medicine before I knew what rural medicine was. I think my experience in a provincial hospital like Whakatane made me realize how great it was keeping all of my skill sets going and being able to look after an entire hospital by myself after hours. I didn't want to lose any of those skills. I wanted to be able to deal with whatever came through the door to the best of my abilities. And then I saw some of my colleagues older than me applying for the program, and I thought it was a pretty good idea. But I hadn't really been to a rural hospital yet at the time I did apply for the program.
What was your favourite part of the training program?
Because you're kind of so isolated during your training, my favorite part was actually the residentials. So we do an academic component through the University of Otago, and that's the time at the end of our semester where we'll have like a couple of days residential in different places, usually kind of related to a rural hospital. But then you could see other registrars talk about their experiences, and then you realize all of us had probably similar personality types. And got on pretty well. And so you started to develop these like lifelong friendships. So yeah, I think that was probably my favorite part.
Do you still stay in contact with the people that you met during the training?
Yeah, definitely. All of us who have gone through the program probably have now picked up different roles in our hospitals, probably more leadership roles. So where we were once registrars in the hospitals, we're probably taking up leadership roles in those same places. And then obviously there's different conferences we catch up with as well.
Great. And what challenges do you face working in a rural setting?
It's probably the social isolation and the geographical isolation that will still kind of persist. Ultimately, you are probably in a very small team. You might be the only doctor looking after some really sick and complicated patients. It obviously, when you achieve and do well for your patient, you know that you have overcome so many barriers to provide that patient really good care. And then obviously in some smaller areas, you might not have that big community, but the community that you do have will look after you pretty well.
Can you describe a typical day in your role?
Typical day in my role changes a little bit. Usually on a ward week, it's sort of 8 to 5, 8 o'clock come and hand over from ED, see what's been happening on the ward overnight, and in the evening, any new patients that need to be admitted, and then start the Allied Health MDT meeting at about 8:30, and then we start our ward round. Probably Monday's a little bit busier because it's kind of like brand new patients, but then as the week goes on, the ward round probably will get shorter and shorter, and then handing over to the registrar to do the rest of the ward round. And then it's sort of just catching up on all the paperwork that the ward round generates, any referrals that need to be happen, any scans, and then obviously discharges a patient out of hospital.
How many patients do you typically see in a day?
So typically, the maximum we can see is probably about 15, because that's the limit of our ward. There'll be some probably relatively stable patients as well. So probably 10 to 15 is the average that we'd be seeing in a day usually.
And how much time do you spend doing inpatient work versus ED work?
Yeah, so I think my work is probably more heavily weighted to inpatient work. Rough breakdown would probably be about 60% inpatient, 30% in ED, and 10% in outpatients. Yeah.
And what's the toughest part of your job, and how do you manage it?
Toughest part for me is still probably working in the emergency department in the evening or at night time, because that's when you're by yourself. You've got amazing nurses who are going to be with you as well, but that's also the time the GP practices shut down. So we are the only place to get medical care for about at least an hour each way. So it's the volume of patients and then dealing with emergencies by yourself, essentially. How I deal with that is probably, I quite like emergencies sometimes because it's just a very basic algorithm to follow in terms of like ABCs. It's probably the volume of patients that's a little bit more trickier to manage.
How do you stay motivated?
I think I'm quite passionate about everyone getting a fair go, and I'm mindful about all the barriers that people would have, especially rurally. And so for me, I always try to think about that and think about ways I can address that. I think I'm probably quite passionate about improving the working conditions for my colleagues, especially, which is why I kind of, when I was a junior doctor, signed up to the union, kind of did things with contract negotiations and advocacy. So I think that's the side of things that keeps me going, where I can make changes in the wider health system that helps my work colleagues, and then obviously by default patients as well.
And how do you support new doctors who are training to become rural hospital doctors?
I think it's just kind of being honest about your own training experience. Just being mindful as to the way I felt during my training, because obviously rural training, sometimes you go to really sort of isolated places. You might be quite socially isolated. So trying to really work on that social aspect in terms of like having team dinners, regular catch-ups, being available to them quite easily if they want to have a call or like a WhatsApp message or anything of that sort. So I think just kind of staying connected, being honest with my experiences, and then just being a bit of a mentor as well, even if after they leave this place as well.
And what do you enjoy about training registrars?
I think the thing I enjoy the most is it keeps me on top of my game. I kind of learn by teaching. And so I've now kind of gone to a role where I'm the clinical lead for the entire rural hospital medicine training program. So it's quite cool to see what registrars' training experiences are, what skills they need, and then kind of advising them and saying, hey, look, this is what I deal with every day. Probably a good idea to get a bit of experience in this area. But they also keep me on my toes, say, hey, have you ever thought of this? So I think it's more of a collegial discussion rather than like a supervisor trainee discussion, which I quite enjoy. And they may have picked up stuff from specialties I've worked at quite recently, and they can kind of update me too. So yeah.
Great. So how do you balance governance, leadership, and your clinical practice?
Probably don't balance it well, but I give it a good go. I think probably over time, I've realized that I've got a bigger skill set in governance and leadership, especially through my past executive experience with the union. So probably starting to reduce my clinical hours a little bit more, put more time into sort of like the governance, put more time into the education component as well, because I think that's what makes me the most happiest, where I can create policies, programs, changes to contracts that will benefit my rural colleagues, and then by default benefit rural patients as well. And I quite enjoy that space, and that's what keeps me going. So yeah, dropping the clinical hours to focus a little bit more on that. And that seems to be working out pretty well at the moment.
So we've seen a bit of Taupō Hospital, but what makes it unique compared to other rural hospitals?
So Taupō is probably one of the few level 3 hospitals across the country, and we have 24/7 ED available as well as the inpatient unit, 24/7 lab available, and X-ray, and of course one of the few places that actually has a CT scanner as well. During hours. We're probably similar in terms of other things, in terms of we have rural journalists and ED doctors and things like that. But I think it's probably the amount of patients that we see, the wide area that we see as well, and being a holiday town too.
What does a level 3 hospital mean?
So level 3 hospital is kind of what we refer to in terms of being 24/7 coverage of medical specialties, and having 24/7 access to lab and radiology as well. So that's kind of what makes us a level 3, having 24/7 service.
What other kinds of healthcare professionals work here?
So obviously we've got doctors, both rural doctors and ED doctors working alongside together, nurses of different scopes. We've got allied health professionals like physiotherapists, occupational therapists, social workers. We've got obviously our radiographers that are there as well. We have a primary birthing unit attached, so I've got midwives working alongside us too. And then we've got a whole bunch of outpatient staff. We've got our surgical staff as well in the theatres, running endoscopy and dentalists. So yeah, wide range of people.
How do you collaborate with the other healthcare professionals?
Because we're a pretty small hospital, and it's like a 1-level hospital as well, you can probably meet everyone on one circle of the hospital. So I think it's just probably just touching base, building those relationships, making people aware that, hey, if you've got any problems, yep, we may not have specialists on site, but we'll try to do as much as possible over here. And so sometimes outpatient nurses might come to the ward and say, hey, we've got trouble with this XYZ specialty patient. Do you mind just starting to help us out in this situation? So yeah.
How do you connect with specialists that aren't on site?
That's a little bit more tricky. We obviously can sometimes go over to our base hospital, Rotara, make ourselves known. Maybe if they're feeling a bit short-staffed, we might help them out as well. That happens a little bit more rarely. It's usually probably like email and phone contact. So we might be like having phone and email contact for a year, and then suddenly we meet them face to face and say, oh, that's you, that's who I've been talking to. But just, I think, keeping up a regular dialogue, especially with probably the heads of department. Our clinical lead meets with them quite regularly once a month. So that's probably the main strong relationship.
And what kind of procedures are you equipped for at Taupō?
So in terms of what the rural generalists do over here, we'll be doing things like chest drains, abdominal drains, lumbar punctures. But the things that we don't specifically do, but other specialists come down and do, are things like endoscopy, dental surgery. Those will probably be the main procedures. Recently, we've been getting more into doing cardioversions, which is about if someone's got an underlying heart rhythm abnormality, restarting the heart with electricity to kind of get them back into a normal heart rhythm. So we've been using our theatre space to do that.
And how do you handle emergencies and critical cases?
Handling emergencies is tricky, depends on the time of the day. During hours between 8 to 5 on a Monday to Friday, we've obviously got about 2 or 3 doctors around. I've got a lot of nursing staff as well. So we have plenty of hands to help us with whatever comes through the door. After hours is a little bit more tricky. So we might be using staff that are not necessarily medical, but they kind of are used to the hospital environment. So people like our orderlies, our reception staff, we might be even using midwives sometimes. We just really need an extra pair of hands for a sick baby or a sick mum who's come into our ED. So it's more just using people who are around, who are comfortable, used to the hospital environment as well, because more hands is always better. They may not be doing something directly with the patient, but they might be doing something like scribing or getting some equipment and things like that.
And what's the most common type of presentations or cases that patients come in with?
I think heart problems and lung problems would probably be one of the big things that we see. Infections would be the other thing, and infections can obviously happen anywhere in the body. Those would probably be the most common things that we see coming through our door. Probably minor injuries is the other one, because obviously we've got the mountain nearby, we've got the lake nearby, a couple of mountain biking tracks as well. There's lots of ways to get injured in our region. So that's probably the other thing that we see most commonly as well.
And what is the typical age of patients that you see?
It's a pretty broad range. Obviously, we can have really new babies coming from our birthing unit. And so lots of young kids. And then generically, even in general practice, we don't see a lot of people between the ages of 25 and 40 unless it's for sort of a minor injury. And then we'll start to see people after the age of 40 all the way sort of into their 90s as well.
Can you give us an idea of what kinds of ethnicities you see?
Yeah, so I think compared to the general New Zealand population, we probably have a higher percentage of Maori patients. Depending on which area around the lake, it can get to probably about 40% Maori population. Pākehā or New Zealand European would be our next biggest population. And then there'd be a mix of sort of Asian and Pacific people as more smaller numbers. So yeah, I think Pākehā and Māori probably be our bigger population.
And what's the most common advice that you give patients?
The most common advice is probably if they're ever worried or if something's going wrong, we're open 24/7. So just come back to us at any given time. Obviously, things that we do, we don't have access to some scans sometimes. So we might say the risk of you having something really bad is low. But if you're worried in any way, just pop up over here. We're open 24/7. Yes, there might be a bit of a waiting time, but we'll get to you eventually.
And how does the hospital support the local community and vice versa?
I guess obviously we're providing healthcare services to our community to the best of our ability. So that's how I guess we work with the local community. But they probably look after us quite a lot. Like sometimes we'll get food coming in through for whatever reason. Some people might shout us coffees and things like that. We've got some discounts at some stores in the region as well. So yeah, I think it's probably an equal relationship, but they definitely look after us pretty well.
And can you share a memorable story or experience from your time at Taupō Hospital?
Oh, that's a good one. I think the most memorable stories are probably the emergencies, because you remember them quite a lot, because you're under a lot of stress. It was probably a full circle story where I saw the patient after all the events happened. They happened to be admitted to our ward with one kind of a disease, but it turned out that it was the heart was the main issue. And we really had to fight with specialists over at Waikato Hospital to get the patient transferred up there, purely because the Waikato Hospital specialist didn't believe that the patient was so sick and the ultrasound that we did was actually real. But after the patient was transferred, they quickly found out that ultrasound scans were actually real. And then I think about a year later, I saw the patient in the emergency department again, and I was quite cool. And he's like, "Oh, you're the doctor that saved my life." No one else was sort of believing what was going on. So it was really good to see that full circle. They didn't actually know that the Waikato specialist didn't believe us, and they thought it was completely ludicrous. So yeah, it was good to have that full circle experience with a really sick patient.
Yeah, nice. It's good to see them again in better circumstances, I hope.
Yeah, definitely.
What do you enjoy most about living in Taupō?
The lake's probably the biggest attraction for me. I absolutely love water. Perhaps not being in water, but just being around water. It's really like a calming experience for me. So yeah, lake is probably the big thing for me. Yeah. Yeah,
great. And what's your favorite thing to do with the lake or on the lake?
Yeah, so kayaking's probably the one where, like I said, I don't like being in the water, avoid the cold, especially in winter time. But yeah, just kayaking, and then just kind of like looking at the mountains after you've had a bit of a paddle, and then realizing how big Lake Taupō is as well. It's really amazing.
And what's the weather like in Taupō?
Weather is pretty variable. In summertime, it's pretty hot, but most mornings are pretty chilly when you start off. Can be a bit foggy and cloudy as well, but then towards the end of the day, it starts to get quite sunny. Not too rainy. It's pretty predictable, not like Auckland when you get like multiple seasons in one day. So yeah, pretty nice, pretty crisp. Yeah.
Yeah, and where's your favorite spot in Taupō?
Oh, that's a good one. Favorite spot in Taupō is probably around sort of 4 or 5 mile bay, just over by Wharawaka. It's kind of like when I was first here and renting out, I was in that subdivision, used to go walk down, beautiful views of the lake, of the mountains as well. So yeah, that's probably my favorite spot in Taupō.
Now, final question. Rural or urban?
Rural all the way, and I can say that quite confidently because I grew up in Auckland, lived there for how long? 15 years of my life, and then I saw the light and I escaped. So rural all the way.
Great. Thank you for your time, Ralston.
Cool. Thank you.